Maintaining healthy blood pressure is crucial, especially as we age. High blood pressure, often called the silent killer, can quietly damage the body for years before symptoms appear. For seniors, managing blood pressure is not just about following a doctor's orders. It's about understanding the habits and pitfalls that can make the difference between thriving and struggling with chronic health problems. Here are 7 critical blood pressure mistakes that seniors must avoid, along with practical advice to help keep your heart and body in the best condition possible. One of the most common and dangerous mistakes is not monitoring blood pressure regularly at home. Blood pressure is not static. It can rise and fall throughout the day due to stress, medication, activity levels, and even what you eat. Relying solely on the occasional reading at a doctor's office provides only a snapshot, missing potentially dangerous spikes or downward trends. Home monitoring empowers you to catch these fluctuations early, track your progress, and share valuable information with your healthcare provider. Invest in a reliable home blood pressure monitor, learn how to use it properly, and record your readings. Make it a routine, just like brushing your teeth. This simple habit can be life-saving, giving you and your doctor the data needed to make informed decisions. Another serious error is misusing or stopping medication without medical advice. Many seniors feel tempted to skip doses or stop taking their blood pressure medicine when readings improve or side effects appear. However, blood pressure can seem normal precisely because the medication is working. Stopping suddenly or altering the dosage without consulting your doctor can cause dangerous rebounds, resulting in strokes, heart attacks, or other life-threatening complications. Always follow your prescribed regimen and discuss any concerns or side effects with your healthcare provider. If you struggle with remembering to take your medication, set reminders or use a pill organizer to stay on track. Diet plays a huge role in blood pressure control, and consuming too much sodium is a hidden danger. It's easy to overlook the salt lurking in processed foods, canned goods, soups, sauces, and fast food. Even foods that don't taste particularly salty can be packed with sodium. Consuming excess salt causes your body to retain fluid, raising blood pressure and straining your heart and blood vessels. Read nutrition labels carefully and aim to choose fresh fruits, vegetables, lean proteins, and whole grains. Cook at home whenever possible, using herbs and spices for flavor instead of salt. Making these changes can dramatically reduce your sodium intake and help keep your blood pressure in check. A sedentary lifestyle is another mistake that can quietly undermine your health. Physical activity strengthens your heart, improves circulation, and helps regulate blood pressure. Unfortunately, many seniors become less active due to joint pain, fear of falling, or lack of motivation. Yet even gentle movement like walking, swimming, or chair exercises can make a significant difference. Try to incorporate at least 30 minutes of moderate activity most days of the week, but always consult your doctor before starting a new exercise routine. Group classes or activities with the friends can make exercise enjoyable and help you stay as consistent. Stress is an inevitable part of life, but failing to manage it can elevate your blood pressure over time. Chronic stress triggers the release of hormones that constrict blood vessels and speed up your heart rate, making hypertension harder to control. Seniors may face unique stresses, such as health concerns, financial worries, or changes in living situations. Develop healthy coping mechanisms, such as deep breathing, meditation, gentle yoga, or spending time in nature. Connecting with friends, family, or support groups can also provide valuable emotional support. Remember that managing stress is not just about feeling better in the moment. It's about protecting your long-term cardiovascular health. Quality sleep is often overlooked, but poor sleep habits or undiagnosed sleep disorders can keep blood pressure elevated and damage the cardiovascular system. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, is especially common among seniors and often goes undiagnosed. If you experience loud snoring, frequent waking, or daytime fatigue, talk to your doctor about sleep testing. Inadequate sleep, less than 7 hours per night, can also contribute to hypertension and other health problems. Establish a relaxing bedtime routine, keep your bedroom cool and dark, and avoid screens or caffeine before bed. Prioritize sleep the same way you prioritize medication or diet. Finally, skipping regular medical checkups is a mistake with serious consequences. Routine visits to your healthcare provider allow for early detection of complications related to high blood pressure, such as kidney damage, vision problems, or cognitive decline. Your doctor can review your medications, assess the effectiveness of your treatment plan, and check for any new risk factors. Regular lab work and screenings help catch problems before they become severe. Even if you feel healthy, don't put off these appointments. Preventive care is one of the most powerful tools you have to maintain your health and independence. It's important to remember that managing blood pressure is not about perfection. It's about making informed, consistent choices. By avoiding these 7 critical mistakes, you take control of your health and reduce your risk of serious complications. Incorporate home monitoring into your daily routine, take medications exactly as prescribed, and make conscious choices about what you eat. Find enjoyable ways to stay active and practice stress management techniques that work for you. Prioritize good sleep and never skip your regular checkups. Small steps, taken consistently, can add up to big improvements in your quality of life. If you or a loved one struggles with high blood pressure, don't be discouraged. There is always an opportunity to make positive changes, no matter your age. Reach out to your healthcare provider with questions or concerns and involve family or friends in your journey to better health. Remember, you are not alone. Support and resources are available every step of the way. By understanding and avoiding these common blood pressure mistakes, seniors can look forward to more active, fulfilling years ahead. A little vigilance and commitment go a long way in protecting your heart, your brain, and your overall well-being. Each healthy choice is a step toward greater independence and peace of mind. Start today and give yourself the gift of better health for the future.